Hi, guys. Welcome back for our daily practice questions. It is day 164 and our Pharm series continues. But as always, I first like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any notifications on my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description so you are able to access all of my resources. And I have it broken down for first time test takers as well as those of you who may be retesting. All right, you guys, let's get into question number one. It states a 55-year-old man presents with a dark, irregular mole on his upper back that has changed in size and color over the past 2 months. On exam, the lesion is asymmetrical, has irregular borders, varied in pigmentation, and measures 8 millimeters. What is the most appropriate next step? Is it A, reassure the patient and monitor in 3 months? Is it B, refer for biopsy the lesion with a punch or excisional technique? C, prescribe topical 5-FU cream, or D, refer directly for cryotherapy. Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate next step? So still, it's asking you for a treatment. And I always say, if we're looking for a treatment, you need to run it back and see if they've given you a diagnosis. And if they have not, then you got to run it back a step further and look at those assessment findings and you determine the diagnosis. So here, the diagnosis has not been provided. So let's take a look at how this patient is presenting. Look at those assessment findings, meaning their presentation, their signs and symptoms, their chief complaint. Consider their age, their ethnicity, their gender, right? So we have a 55-year-old man who comes in with a dark, irregular mole on his upper back. It has changed in size and color over the past 2 months. It's asymmetrical, it has irregular borders, varied pigmentation, and it's measuring 8 millimeters, right? So I want y'all to think melanoma off top. Think about what we do when we think about melanoma. A, B, C, D, and E, right? Asymmetry, your borders, the color, the diameter, right? Think of all of those things, and all of that is described here. So with melanoma, how do you treat this? You're going to refer them for biopsy because that lesion needs to be biopsy, either by a punch biopsy or excisional, but we need to refer them out for that biopsy to be completed. Question number two. A 7-year-old girl presents with intense nighttime itching and excoriated papules on her wrist, between her fingers, and around her waist. Several family members are also affected. What is the most appropriate first-line treatment? Is it A, oral ivermectin? Is it B, topical paramethrin 5% cream? These words be tearing me up, y'all. Is it C, diphenhydramine? Or is it D, hydrocortisone 1% cream? Take a moment and tell me what you got. All right, all right, all right. Stem of the question. What is the most appropriate first-line treatment? So we're going to run it back and see if we have a diagnosis. We don't, so let's look at how the patient is presenting. So we have a 7-year-old girl who comes in with intense nighttime itching and excoriated papules on her wrist, between her fingers, and around her waist. Y'all, this is classic presentation for scabies, right? Especially that between her fingers. Scabies commonly will present in the webs of the fingers, right? So remember, with scabies, our first line treatment is B, that topical paramethrin 5% cream, also known as Elamite. I always say, think of it as eliminating the mites because scabies are mite bites, right? So Elamite, Elimite, looks like the combination of eliminate and mite, right? So that's the same thing of your topical paramethrin. So B is your best answer. And C, question number 3. A 70-year-old man presents with multiple rough, scaly patches on his scalp and forehead. These lesions are diagnosed as actinic keratosis. What is the most appropriate initial outpatient treatment? Is it A, topical retinoid cream? Is it B, cryotherapy with liquid nitrogen? Is it C, biopsy? Or is it D, topical mupirocin ointment? Take a moment and tell me what you got. All right, so stemming the question here, what is the most appropriate initial outpatient treatment? All right, and in this scenario, the diagnosis is provided. So the patient has been diagnosed with actinic keratosis, right? So remember that the treatment for this, the first line therapy, is B, cryotherapy. Actinic keratosis, presents in those sun exposed areas. So think about it. This patient has these scaly patches on the scalp and forehead because it's sun exposed. So with these, they're not um, a threat as far as something that may be life threatening, I should say, but more cosmetically. But cryotherapy is the easiest way to get rid of these things. But you do want to monitor this. You do want to advise the patient to wear hats and cover when in sun exposed. When being exposed to the sun, I guess I should say it that way or phrase it that way. But your best answer is B, cryotherapy. Also, you guys, when you're doing anything with derm, pay attention to the location. I always say location, 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 because things commonly present in certain areas. So when they're describing it in a question format, the location is going to give you a lot of key features so that you can narrow down your differential diagnoses. Okay. So that location is one of the key components of the presentation when you're reading a question or when you're seeing this patient in front of you, okay? So make sure to consider those factors whenever you are reading a description or listening to your patient, or a patient may be showing you a certain dermatologic issue, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And my website is also linked in the description of this video. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.